Congratulations on your new addition. The birth of a child is a momentous event for you and your family, and one you have been preparing for most likely for more than 9 months. Your journey ahead will be filled with excitement, joy, pride, and undoubtedly some uncertainty, frustration, and fear. This video is intended to ease some of these fears and prepare you and your new family for your transition home. Our presentation is meant to be a brief overview of some of the basic care topics. Don't worry, you don't have to remember everything that is covered here. Your nurse will provide you with some written information to take home with you, and you can always visit our website for an electronic version of this and additional information that you may need once you return home. We have also tried to provide you with some online resources that you may find helpful. But as always, if you have any concerns or questions about how to care for yourself or your baby, please do not hesitate to ask any member of your care team before you are discharged. Your obstetrician's office is also a good resource. Many offices have a nurse available to answer any questions and address any concerns that you may have during business hours. There is also a physician on call during nights and weekends that can address any concerns that cannot wait until business hours. In the weeks following your delivery, your body will gradually begin to heal and return to its non-pregnant state. The amount of time that this will take may vary depending on the type of delivery you had and other associated conditions. Perhaps the most noticeable part of your recovery will be after pains. Feeling somewhat like mild contractions, these pains are experienced as your uterus begins to return to its normal size. By the time of your delivery, your uterus has stretched to around 11 times its normal size to accommodate your baby. In about 6 weeks' time, your uterus will shrink from weighing about 2 pounds to a mere 2 ounces. These pains will be most noticeable in the first 3 to 4 days after delivery and may be more pronounced during breastfeeding. To ease these pains, try changing position, laying on your stomach, and emptying your bladder. Tylenol or Advil may also help alleviate the pain. You will also experience a vaginal discharge that will be most noticeable in the first 3 to 4 days following labor. This drainage of fluids, called lochia, will resemble a menstrual flow at first, but will lessen over time to be minimal by 4 weeks. You may pass occasional clots of blood, and the discharge may be heavier after sitting or lying down for a period of time. This is normal. Call your physician if bleeding becomes heavy, you are passing clots larger than a 50-cent piece, the discharge begins to have a foul odor, or you have a temperature of 100.4 Fahrenheit or higher. Because of the exertion that labor required, you may experience some muscle aches and fatigue. This is normal and is just joint stiffness caused by the redistribution of fluids in the body. If you had an episiotomy, it should take about 4 weeks to fully heal. During this time, it's okay to shower and bathe normally, change your sanitary napkin or pad frequently to avoid infection, and rinse the area with the squirt bottle given to you after each urination and bowel movement. If you had a cesarean or C-section, expect to need some help getting around once you return home. Getting up and moving around will help you feel better, heal faster, and may help to prevent blood clots. The healing process should take about 4 to 8 weeks. During this time, try not to lift anything heavier than your baby and plan to take short walks and only engage in light activities until you are comfortable. At first, your incision will be swollen and somewhat pinker than the rest of your body. The swelling will subside in the days following your discharge, and the scar will become less noticeable over time. Any pain that you feel now should feel better after a few days home. Your incision may be tender to touch for a few weeks. Keep your incision site clean by washing it with mild soap and water. Do not soak in a bathtub or hot tub or go swimming until your doctor says it is okay. If your incision becomes red, swollen, tender, warm, or it is draining, call your physician's office. Bringing a child into the world is a big step, both physically and emotionally. One moment you may feel overwhelmed with joy, and the next you may feel worried and anxious about the responsibility of caring for your new child. These are all normal feelings. During the first few days, you may experience what is called the baby blues. The blues may include impatience, irritability, crying, and feelings of sadness or worry. But don't worry, about 70% of all women experience the baby blues. These are feelings and they are normal and should only last anywhere from a few hours to a week or so. If these feelings last longer than a week and/or begin to worsen as time goes on, you may be facing postpartum depression. Symptoms include loss of appetite, crying, feelings of hopelessness, overconcern or no concern for your baby, an inability to sleep or excessive sleep, or little or no concern about yourself or your appearance. It's important to understand that these feelings are not a sign of weakness or inadequacy. At the onset of these feelings, be sure to contact your physician's office as soon as possible. You may have already noticed that going to the bathroom may be a little different following childbirth. You may be eliminating large amounts of urine as your body rids itself of excessive fluids. You may be experiencing some difficulty urinating due to some bruising or swelling of the tissues around the bladder. And the act of urination may be painful as a result of the trauma of vaginal delivery. These symptoms should all subside in the days following your discharge. Contact your physician's office if you're experiencing any signs of urinary tract infection once you are discharged. Signs include pain when urinating, not emptying your bladder when urinating, or experiencing an unusual frequent urge to urinate. You may also notice that you leak urine when you laugh, cough, or exert yourself. This is a result of the stress your pregnancy put on your bladder muscles. You can strengthen these muscles by practicing Kegel exercises. You may also experience constipation following your delivery. This could be caused by a number of reasons. If your first bowel movement does not occur in the first few days after delivery, a laxative or stool softener, as well as light exercise and a diet high in fiber, may provide relief and help to avoid the development of hemorrhoids. If breastfeeding, consult your physician before taking any medications. If you develop hemorrhoids, stretched or swollen veins surrounding the anus, soaking in a warm tub or a topical cream may help to provide some relief. Your normal menstrual cycle should occur within 7 to 9 weeks following delivery. It may be heavy at first, but will gradually return to normal after a few cycles. Breastfeeding may further delay menstruation. Be sure to use protection if you do not want to become pregnant during this time. Even though you may not have your menstrual cycle, you may still be ovulating. About 6 weeks after delivery, you may feel ready for sexual intercourse. Inquire with your physician at your 6-week postpartum visit about resuming these activities. Make sure you are comfortable before doing so. There is no rush. Vaginal dryness is normal at first, and the use of some lubricant can be helpful. Tenderness may occur and should be temporary and improve with time. Remember to use protection if you do not want to become pregnant. Taking care of yourself properly is an essential part of recovery. Be sure to eat a healthy diet, participate in moderate activities, and get plenty of rest. Maintain a balanced diet full of fruits, vegetables, low-fat dairy, lean meats, and fish, as well as whole grains. Be sure to also choose appropriate portion sizes. If you would like more information on weight management, visit our hospital website for available programs. It is normal to weigh the same or more after delivery as you did before you delivered. This is because all of the fluids that you were given during labor. As you lose your water weight, you may lose up to 20 pounds after delivery. It is best to lose about half a pound per week after the first 10 days. If you are breastfeeding, do not diet. A sensible diet and exercise will be all you need to help you stay strong and lose weight. We have now reached perhaps the most important part of this informational video: when to contact your physician's office. Please be sure to contact your physician if you experience any of the following issues: bleeding that soaks a pad every hour for 2 hours or more, a foul odor from your vaginal area, a fever of 100.4 degrees Fahrenheit or higher, unrelieved incision or abdominal pain, swelling, redness, discharge, or bleeding from your cesarean incision or episiotomy site. Your incision begins to separate, problems urinating, no bowel movement within 4 days of delivery, visual disturbance, or a severe headache. Flu-like symptoms: pain or redness in one or both breasts, pain, warmth, tenderness, or swelling in legs, especially the calf, frequent nausea and vomiting, signs of postpartum depression. And this is most important. If you experience chest pain or problems breathing, call 911 immediately. Remember, this and additional information is always available to you on our hospital website, chestercountyhospital.org. If you have any questions about the information covered, please be sure to speak with a member of your care team before going home. We thank you for choosing Chester County Hospital to share in this special time in your life. Should you need us as your child grows, please know that our emergency department is fully equipped to care for infants and children of all ages, and our pediatric unit is an affiliate of Children's Hospital of Philadelphia. CHOP pediatricians are on site and available 24 hours a day, 7 days a week. Best wishes to you and your family.